You truly don't know until you step in this building how life-changing this place is. There's just something about it.
I would call this a place of hope. It's also a place of joy. It's also a place of incredible challenges. And it's both complex and it can be really simple. It is this really interesting encapsulation of what I think life is all about.
My whole life, all I can remember is, coming to MUSC and having nurses take really good care of me. It's astounding being like one of probably few people on earth who has gone through 2 separate complete heart transplants. To think about it, that is in total 3 hearts I think I've had in my lifetime.
In October 2010, I was diagnosed with T-cell ALL. I was at the State Fair in Columbia, and I all of a sudden could not walk. The EMTs that were there said, "You need to go to the hospital right now." They took blood and did scans and everything, and they said that it was leukemia. And I can remember hearing my mom screaming. I met Dr. Jurasic. She said, "You're a little sick, so we're gonna take care of you."
This place is truly a place where miracles happen. My son was saved here. He would not be here today if it wasn't for the team that took care of him in the NICU, and I am forever grateful for that.
When I was 9 years old, I was diagnosed with a heart condition. And at the time, I was living in New Jersey with my family, where I was born and raised. And our cardiologist, after working with me for about a year on different medications and different lifestyle changes, it was decided that I needed a procedure. And our cardiologist there shared with my parents that MUSC had the best outcomes.
At 22 months old, I was diagnosed with a kidney disease called nephrotic syndrome. I had many different treatments. They made me feel like I was just cared for, and the care they provided to me is the reason I'm here today, and it's the reason I want to help people. It's the reason I want to be in the medical field.
Nurses are the connection of people in healthcare and their families. A nurse is the person at the bedside who knows that family better than anyone.
My name is Jesse Dassinger, and I'm a registered nurse on a cardiovascular acute care and transplant floor.
I'm Olivia McPherson. I've worked at the Shawn Jenkins Children's Hospital now for 7 years. I help kids going to the OR and coming out of anesthesia.
My name is Riley Clem, and I work in the emergency department at the Shawn Jenkins Children's Hospital.
My name is Kirsten Labar. I am the Associate Chief Nursing Officer for Children's, Women's, and Behavioral Health here at MUSC.
My name is Joseph Greenwood. I am a longtime patient of MUSC who is now a care team member.
And I would just watch the nurses take care of these children and just be like, wow, I want to be just like them and be able to care for these kids and help heal them and just be a part of their story.
The nurses are part of their family.
I mean, I called them my second family for a long time because they were family to me.
I was given a second chance, and I wanted to make sure that I used that to care for people and to make sure that they felt not alone. All the nurses, they all tried to be nice and hold your hand and stuff.
With a little love and some tenderness, we'll walk upon the water, we'll rise above the mist, with a little peace and some harmony.
If you haven't been inside of MUSC Children's Hospital, you should go sometime. They're doing amazing stuff. They're doing amazing things. They're creating miracles. The nurses are the ones you see every day, and they're the heart and soul of the hospital. MUSC has always been very special to me because my mother worked there for 30 years.
I'm so appreciative of Darius Rucker acknowledging his mother in this way and building a legacy that will allow us to create more and more nurses at the bedside.
Carolyn G. Rucker Scholarship, it meant the world to me. It meant the world that I was going to be able to help other people go through the process of being nurses and not be so much as far dead as they have to be, and they can go on and just be the best nurse they can be. And that meant the world to me, that I can help like that. And that's what this show's all about.
The Carolyn G. Rucker Scholarship will benefit nurses by allowing us to help them achieve advanced education and training, which ultimately leads to improved outcomes, improved quality for not only our patients locally, but also our patients across the state and the nation.
The best that I can.
I truly believe that this place is miraculous and the people that work here are just incredible. And we really couldn't do it without the help of our community with the donations that we get.
It's the hope that you're helping to give people.
It's going to be a great night of music, but it's also going to be a great night helping MUSC and no better cause.
It's an opportunity to think about, that we're all pretty lucky in our seats, that we don't have to deal with some of these things that many of these families do. There's always this hope and optimism that we can at least try to make it better. And that brings out something really special in people. A place of great challenges and tragedies at times. Why are people so hopeful? Because I think it brings out what is the best of humans when they have to figure out, well, what is really important.
I wanna love you the best that I can.